Hi, I'm Frank, and today I'm going to show you how to treat a casualty with a heat-related illness. Firstly, you need to identify that the casualty has a heat-related illness. Some signs and symptoms are the casualty may be agitated, you may feel dizzy, you may feel nauseated, or may start vomiting. Ultimately, the casualty may feel faint or may collapse. What you need to do once you've identified this is stop whatever activity the casualty is doing. Remove them from the environment, either place them in the shade or bring them inside to a climate-controlled room. Next, what you need to do is remove the casualty's clothes, strip them down to his underwear or his shorts. If the casualty is conscious, encourage him to sit up. Gary, would you mind sitting up there, please? And so remove your top there, Gary. You can sit back down there. To cool down the casualty, what you can do is sponge down his body with a sponge using tempered water or spray him down. It is important not to use ice cold water as this may shock the casualty. If the casualty is conscious, you can encourage him to sip a cup of water. Okay, would you mind sitting up for me there, please? Now just drink some small sips of this water, please. Okay, let me sit back down there, really. If the casualty is unconscious, we will place it in a recovery position while waiting for ALS to arrive. While waiting for ALS to arrive, we will do a set of vitals, mainly checking the casualty's core temperature.